Jen at Kelsey K9. This is my friend Christy.
Hey.
Christy is Moose's mommy. And Moose and Christy are going to help me talk to you guys about obesity in canines. This month is our focus on obesity. And I wanted to show you guys Moose, not because he's overweight, but because he is the ideal weight. It's hard often to get an ideal weight on a large breed dog like this, but Christy has done quite well. So I'm going to use him to show you the body conditioning score that we use. First and foremost, when you are standing over your baby like this, you want him to have an hourglass figure, him or her, sorry. You want him to go from ribs to hips. You would like to have that curve in. You also want to have a hump right here. If it's straight across or if it's hanging down low, they may be considered obese, overweight. But if it's like this, it's absolutely perfect. You also want to be able to make sure that you can rub along their spine and their chest, and you want to be able to feel the bones in their spine and feel the bones in their chest, but not see them. If you can see them, they probably need to put on a little weight. If you can't feel them, then they probably need to back off the food a little bit. But the body condition score runs from a 1 to a 10 on the scale, and 5 is perfect, and Moose is a 5. He is a good looking beast.
High five, Moose.
You can get a treat and get down, buddy, if you want to. Going down, kiddo. So if your dog is overweight or obese, or you are questioning that, please keep in mind that they have the same disease processes that we do most of the time when it comes to that. So you are looking at problems like hypertension, heart disease, arthritis. Arthritis is a big one, especially in Moose's case. Those big boys tend to have arthritis problems, etc. The big one is cancer. You know, inflammation is the #1 factor with cancer. So we do have to keep that in mind too. So if you think that's becoming a problem with your baby, please give us a call. We have a couple different options that we can talk about. First and foremost, we'll probably get them on a good food, a diet food. We have 2 different options here. Da-da-da. This would be Purina OM for overweight management, and or Royal Canin Satiety. Both of those are great, and our doctors here have a calorie counter too. So they will be able to tell you exactly what your dog should be eating throughout the day, including treats. Remember, you have to count those too. It's just like when we go get a milkshake, we gotta count it in our daily calories. So keep that in mind. Oh, good boy, Moose. You also want to think about things that you can do to keep them active. #1, now that everybody seems to be going back to work, is doggy daycare is an option potentially. Instead of having them sit at home all day in front of the fire during the winter, they can go play with their friends. Dogtopia is actually sponsoring our Overweight Awareness basket this month. If you guys have not seen that, you need to either go to our Facebook page or online to our website, kelseyk9.com. And you'll see it, it's got a yoga mat in there. It's so cute. But it's got lots of different things that can kind of teach you and help you try to battle obesity in your baby. Also, please keep in mind that you yourself are a treat to your patient, to your baby. Our patient's your baby.
You hear that?
The time spent with you, walking or running or playing or fetching, whatever you guys are doing together, that is a treat in itself. So, get active with your babies this winter and get them under control, because we sure don't want any problems in the future related to that. Moose, you were amazing. Keep following us and you'll find out more. Bye.